I'm Helen Pestana, and I work at the intersection of communication, creativity and design, and education. I'm also a board member of the BAPD, who are sponsoring this conversation. And I'm joined by three brilliant voices in the industry, all with completely different perspectives on communication. Jenna, I'm going to start with you, put you on the spot. You sit at the receiving end of prescriptions, photographs, and notes that leave a surgery. So from the lab side and your perspective, what is the single most common communication failure that you see from clinicians in your practice?
Exactly that, though. Exactly that, communication failure. So the most common, just from my perspective as a ceramist in the dental lab, is not communicating shades, which is one of the biggest things. No shades, no photos, and demand for high aesthetic cases. So it's really hard to determine the details in that if you don't have that information.
So that's a real failure of communication, isn't it? Wouldn't you say? I mean, Manrina, with your high aesthetic complex cases, how do you make sure that the lab gets all of that right? Because obviously there's so many subtleties, aren't there?
Yeah, there's just no way you can communicate with your lab effectively without photography. And I have that so often when I'm talking to dentists, even within my mentorship program, or dentists who come to me for advice with a case and they're like, oh, I keep sending it back to my lab and they just can't get the shade right on this tooth. And I'm like, but what's the issue here? You're giving them the base shade. Have you made sure that the base shade, the brand of base shade you're using is both the same? Are you, we use the Ivoclar stump shade. Are you both using the same brand? Do they understand? Have you sent photos? Are there different shades within that base shade? Have you shown both the shades? Have you outlined the different shades? Have you got some great photography of that? The photography element's so important. And I think just there's way too many dentists that when I have that conversation with them, say, oh no, I didn't take any photos. And I'm like, but why? And they're like, oh, I didn't have time. It's like, are you joking? Because isn't this taking so much more time now? Now you have to have this veneer or crown remade 3 times to try and get the shade right. So, yeah.
So the level of detail is underestimated really by many clinicians, isn't it? And I just thought, Cat, I'd bring you in here. Do you think that the lab should ever have access to the patient, whether it's via video or some sort of conversation?
I mean, I was going to exactly say that. I feel like the communication is lacking from way before you even have a patient.
Yeah.
The things that Manrina said is so valid. You need to have that relationship with your lab more than anything. And if I had a relationship with the lab, I would know what shade light they'd use, and they would know my preferences. If I was a dentist providing indirects, then obviously they would know my preferences. And I think that communication piece is not only patient to lab or clinician to lab, but it's a bit of everything.
It's a bit of everything.
And a relationship that starts way before you even get a patient in. And then bringing that patient into that relationship is one of the magical things that we can do. I mean, personally, obviously, I don't offer indirect restorations, but I do offer smile design and bonding, and we do stent-led veneers, and I don't communicate the patient's wishes to my lab.
Because so often what the patient wants out of their smile is quite an emotional requirement, isn't it? I mean, you must see it a lot in all of your practice, that they want their smile to do something for them more than just, be a set of veneers.
Case in point, what is their smile like? I mean, so many dentists will send a retracted image maybe so you can get the shade, but are they sending how those lips, those muscles, those tissues work around that smile? Actually, I think sending maybe a video of your patient to the lab,
do you like getting a video?
We do have some clients that send videos, which is really helpful, especially if you're doing like a full mouth restoration. But I think it's also important to know what shapes.
Yeah.
Because some patients have a real good idea of what they want. They want a full smile makeover, or some just literally want to have it blended in, even if they've got some cracks and staining, they want that blended in so people can't tell that they've had.
But there's also an element of sort of like you send some lab work off, and it's like hoping and praying until it comes back. And actually, there's recently been a lot more labs that I've worked with who sort of send back a memo, right, of what they're doing, what the work's looking like. Or I've done these embrasures, or I've made the incisor edges look like this. What do you think? You know, and I've loved that back and forth.
It's so interesting because you talk about you sit back and you hope and pray it's going to come back well, but you would never handle the communication in your practice like that. You would just not hope and pray that the therapist gets it right, or the nurse gets it right, or the receptionist gets it right, would you? So I think what I'm hearing from that is that the lab needs to be a part of your team. It's such an integral part of your team, isn't it? Yeah. And
I met someone earlier, and he was like, "Oh, you know what? I really wish someone would do a lecture about communication with the lab." And I was like, "Are you joking?" I was like, "Are you joking?" Because you know, he's not here. Actually, where is he? We should message him. And I was like, "Are you joking? Are you making that joke because you know that we're having this conversation later?" And he's like, "Oh, are you talking about it later?" And he's like, "Can you just tell the lab? Can they please just read my docket? Can they send back the shade that I'm asking for? And can they look at the return date? That would be great. Thank you." I was like, "What sort of labs are you using?"
So sometimes do they consider what that stomp shade is as well?
Yeah.
Because, you know, if you have something like an Emax and it's a high translucence Emax and they've got a darker floor and they insistently want that Emax, we haven't had that information come across to us. We can go for a shade that they've given us if it's an A2, an A3.
Yeah.
The minute that
If you want a bigger change, you need more
the
space.
minute they get that in the mouth, they haven't told us they've got a darker stomp fit.
Yeah.
That's not going to match.
Yeah, we should have had him here.
Yeah, we should have. It's really, really, really interesting, and I want to move us on. But really, and we've only got half an hour, so we're kind of rushing through the three sections. But what I'm hearing is that you need, as a practitioner, to use your lab as one of your staff. That communication needs to be consistent, organised, and they need to trust it. Absolutely,
they're part of the team. They're not separate.
Yeah.
Like you can't.
Absolutely,
they're
you
half
can't.
the part.
But
They're half the team in a ceramic relationship.
so-
when you're doing a smart makeover, we're equal in how important the
Very,
ceramics
very
is.
hard when there's such a. At the moment, so many practices are sending everything, abroad, and that communication could get, even more diluted. So yeah. So with that, I want to move into the team, and I want to take us into your practice and into a practice. And we know that there is so much communication within a practice between the receptionist, the dentist, the nurse, the therapist, the dentist, goes on, and obviously the patient. But I want to come to you, Manrina, as a principal of a sort of high-profile practice. How do you ensure that the communication within your team remains clear and consistent, and that it permeates in the culture and what people are seeing?
Yeah, so we're really big on communication at DRMR, so much to the point that as a team, we say that we move as one body. So if a patient has said something to one of us, then we should all know that piece of information. We never want any of our patients to repeat anything that they say. And so we have different systems in place to make sure that happens. Firstly, we have regular meetings. So we have our daily huddle every day. We have a weekly team meeting, and we have a monthly practice meeting.
I think we should call it a cuddle.
A cuddle!
A cuddle, not a huddle.
Cuddle. And separate from that, we have the apps that we use to make sure that we're able to communicate non-verbally. I think it's really old school to be like, can you go and tell that person that?
Absolutely.
And you're walking past someone in a corridor and you expect them to remember what it was that you just told them. Like, when are they going to write it down? How are they supposed to keep it in their brain? So, I mean, we use Trello. We find it really, great to have the different boards. We put our tasks on there.
So it's using new ways of communicating. It's learning new skills, really. And when it comes to education, you're both educators with the academy and your education. Do you find that people who are graduating either as dentists or technicians or therapists, do you feel that they are learning enough about those soft skills, the sort of communication is integral to our industry, isn't it? Do you think they're learning enough?
What's really
is there any
interesting
happening?
is that, certainly from my professional point of view, the scope of practice is limited. So if you look at the scope of practice for document as a whole, it says that, you know, dentists can do anything in dentistry, right? So that means that as dentistry comes on, and as you get these amazing workflows, you do these incredible things that were never in dentistry 20 years ago when I started working with patients. You know, dentists get to evolve, and so does their training. But hygienists and therapists and clinical dental technicians, I suppose, to a point as well, there is a defined scope, and that hasn't actually moved on with technology. So there's, you know, for instance, taking a iTero scan. It's a bit of a grey area, really, as to who is allowed to take a scan. Is it classed as an impression? Does it need to be diagnosed or treatment planned or prescribed?
So that's to do with scope of practice, you're saying?
That limits the communication and the ability for us to learn more things and to be trained in more things.
Such an important part, really, because when you think about our industry, so much of it is based on how we communicate and the relationships that we build, really, more than anything. So I think there's a picture emerging, and I think that what I'm hearing is that if we don't communicate well with the lab, don't communicate with ourselves and our team, that really it's very hard to get the patient to say yes if things aren't aligned. You know,
I mean, what an amazing example with DRMR is that, you know, they obviously know that when a patient has to repeat themselves,
It's annoying.
It's annoying. It takes something away from the patient's
absolutely,
confidence
absolutely.
as well. And so having that slick team communication, however you do, is, I mean, it's definitely something I think we should all learn.
Yeah, I think we should learn from that. And this leads me into the third part, which is practice and public. Now, that's a real biggie. And in this ever-changing world, I would say that your communication starts long before they sit in your chair, don't they? So what do you think, or let me get back to you, Manrina, having built a successful practice, do you think that your brand and your communication technique and your identity have been integral and fundamental to the success of your brand?
The communication of
The
it.
communication part
of
of
course. So I think, you know, we can only reach so many people in person. So, you know, you can put a sign outside your practice, and hopefully people will walk by and they'll notice it. Or, you know, they may walk by and not even notice it.
Exactly.
You can put leaflets to people's doors, and you're limited by hands, you know, and time, and how much of that you can do. Or if you employ someone to do it, how much they can do, and then you're limited. Are they going to look at it, because it's going to come through their door and it may go straight in their bin. And you're limited to how many people can walk through your door, and how many people will look at the Smile book at your reception desk, or look at your patient lounge screen and actually see what you're promoting there. So if we don't take ourselves online to communicate with the larger public, we're limiting our reach of our messages. By going online, suddenly look at, you know, what's available to us. There's
Absolutely.
a variety of platforms. You can have long form content on YouTube.
And of course now we have AI playing a big part of it as well, don't we?
Yeah, I mean, we get a patient a week from ChatGPT or Copilot from
Absolutely,
AI.
yeah.
And it's such a massive referral source, because it's almost like a word of mouth recommendation. Like when you say to someone, like, oh, Cat, your hair's always lovely, who does your hair? Oh, he's amazing, blah, 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 you should go. I'm going to go and I'm sold. AI does the same thing. Like, who should I go to for my veneers? And AI will be like, oh, Manrina, she's amazing, she's this, she's award-winning, she's blah, blah, blah. And, you know, they're sold. AI sells you.
And that's where the whole communication needs to work, because they need to get to your practice, and then that needs to follow through. So how do you make sure, because you're all online and how do you make sure that your message is honest and ethical? Because there are so many that aren't. Do you have your own sort of protocol that you work to?
Well, I think it's just really important that you have a set of values that it's something that is integral to what you are, who you are, and what you want to provide. And so long as you have that, and you know who you are as a person, as a clinician, you know, whatever it is that you want to provide, if you have that message to start with, and you're going to be able to then follow it through, and patients will know who you are before they even walk through your door, and then you reconfirm that by giving them the amazing customer service. Yeah. Marina's practice is like a hotel. It's a boutique hotel, and she gives that.
I'm moving in.
She gives that.
Welcome.
You
Come.
give that by yourself as a human being, and so it's integral to you and your values, and therefore it's carried through. And so that's why her patient base is so successful.
Absolutely.
And people who could have all the most amazing advertising in the world, turn up at the practice and it doesn't feel the same as what you were expecting. That's when you're
in the same breath, you can have the most amazing social media and really strong communication, but if they get to your practice and clinically you're rubbish, and you don't have standards and quality dentistry in terms of caring for the patient, it works both ways, doesn't it? Jenna, can I bring you in, not as a technician, but as a patient? What is the biggest mistake that you think a dentist can make online when they try and attract patients? What do you think? Because there are so many you can see they get really wrong.
Well, I think it's integrity and being honest about what you're doing.
Don't use AI photos
No.
of your work.
Talking about that earlier,
I think it's going to be a yes man. Patients can come in, they see all these wonderful things online now that you can have your teeth like this, you can have all these brilliant settings. But you need to manage those expectations, because depending on the clinical side of things, what can be done, everybody needs to be on the same page. So it's not saying going online and saying we can do this for you. It's like you have online. You say we can do this for you. You have to.
You have to do it.
Fit a certain criteria to have that
Yeah.
done. Not everybody can have veneers.
So do you think that social media and the digital world has changed expectations?
Oh, sure.
How do you manage those expectations?
For me, it's about giving the patient and so much respect in education. So I want my patients to come out of my surgery knowing just as much about their mouth as I do.
So it's more about education and selling when you've got them there.
It's never selling. It's never selling. Because if you can show them every single part of their mouth, explain how that relates to each other, explain how occlusion relates to orthodontics, relates to being able to get these amazing veneers. The patient would never choose to pay for amazing veneers if they knew they were going to come off because of their occlusion. So we don't sell. We just really put the time and patience into education in our practice, and I think that's what sells.
So what I'm hearing is that there has to be a consistent message. The message has to be about quality, and I've just written something down here that I've sort of cobbled together. You're all saying really that communication can't be accidental and it can't be an afterthought. It's such an integral part of being a successful clinician.
Yeah.
It has to be intentional.
And it has to be carefully considered. Yeah. That's right. But also it has to be honest, and it has to be practical, and it has to, I think, at all times hold the patient at the center of it all.
I mean, to me, the absolute best thing about dentistry, and the reason I love it, is that you can provide the most beautiful care for the most, for doing the absolute best thing for that person, and at the same time, it's actually supportive and profitable for myself, my business, my practice. So what's great about dentistry is that by being incredibly ethical, you're actually providing the best possible care and also making the highest profit. There's very little industries where being ethical and being able to deliver the best is actually also the most profitable approach.
Absolutely, I agree. Really, really interesting. Now, if I had to put each of you on the spot and say to you in 2 sentences, give each person in this audience something that they can take back to their practice and put into practice on Monday morning, that's going to make their communication and their relationship with the world and their colleagues better. I'll start off with you, Cat.
I was saving up to the end.
I know you were.
I would, well, I mean, I'm going to go with an aligned strap line.
You can have more than 2 lines. You can have 4 lines.
A line strap line is scan every patient, and for me, I would say scan every patient and show them the scan. You know, it's that respect of showing the patient exactly what you see.
So when you're talking scan, are you saying the actual scan, or you're saying emotional
digital.
intelligence scan as well?
Absolutely.
Because that's critical.
I mean, reading every patient's sort of like where they're coming from is the key, but treating each person as an individual, for me, is without a doubt the most important thing.
So with you, patient is core.
Take
That's
more
a good one.
photos.
Take more. I want more than 1 line.
Oh,
Tell
more
it-
than 1 line.
I said 4 lines.
More photos. Put it on a t-shirt. Take photos of your patients. Take before and after photos. Take photos, put them online. Showcase what it is that you're doing. Take more photos.
So take more, and honestly, even sort of not as a joke, photos are going to help you when you talk to the lab.
Communicate with your lab with the photos.
They're going to help
Showcase
you
your
when
work
you
online with the
communicate with your
photos.
patient.
Show your patients what's in their mouth with the photos.
Exactly.
Take them and show your team the work you're doing with the photos.
Yeah. I mean,
Take
it
more
sounds.
photos.
Yeah, take more photos. Really good and good
Good
photos.
advice.
What about you, Jenna?
Definitely everything these two says, and it's managing those expectations. Take more photos, talk to your lab, talk to your technicians. Don't
Talk to your lab.
push
That's such a good one.
anything until you've spoken to the lab, because they can tell you what materials would work best. You know, it can't be an EMAX, it has to be a zirconia, or vice versa. Talk about shapes and shades in the photos. It's really important that you talk to the lab and that you're all on the same page, and that way you know that you are managing that patient's expectations and nobody is saying anything different. If that's really important.
So what I'm going to take from this is scan, photos.
Talk to your lab.
Don't be
No.
a yes man.
Communicate. Yeah. Shade. I was going to say scan, photo, shade.
Yeah.
So-
you can have the dentist can have a plan in place, but if you're not sharing that plan with the technician or the lab, you can end up in 2 different ideas of how you want to go about this, and that's where mistakes can happen. So it's definitely important to all be on the same page.
Well, I think the message we can take from today is that really communication is at the core of everything that we do as dentists, and if we can be honest and ethical and provide our patients with considered communication and valuable information, we're going to all be okay. And really, I just want to say thank you to Cat, Manrina and Jenna, and there is an invitation on your chair to the BAPD networking event, and really what I'd like to say is quality dentistry is what we all need to focus on and get the word out there. Thank you very much. Thanks for joining us. Thank you.